identifying opportunities for improvement, and participating in the improvement process by incorporating evidence-based practices. These elements were embraced by our next award-winning team. Bellin Health recognizes the CHF Patient Care Redesign Team as this year's recipient of the Values in Practice Award for Team Improve. Congestive heart failure, or CHF, is a complex medical condition. Across the nation, these patients have an extremely high rate of readmission to the hospital. Bellin's cardiology associates formed a CHF Patient Care Redesign Team to improve the situation.
Congestive heart failure is when patients have a weak heart muscle and fluid starts to build up in their body and in their lungs. And when that happens, patients become symptomatic. They feel short of breath, their ankles can become swollen, they can have abdominal bloating, and their weight typically goes up.
The patient would be seen in the hospital, they would get some diuretics to help them feel better, fluid come off, and then we would say to them, follow up with your primary care doctor in the next 3 to 4 weeks. And if you look at it, the majority of the readmissions would have already happened to the hospital before they even got to see their primary care doctor. So what we did is sort of fundamentally question the way we do everything.
The biggest challenge in redesigning the heart failure was just coordinating all the moving pieces. It seems like a very easy concept, but once you actually try to start doing it, you're realizing that there is a lot more involved.
Our redesign process has been lengthy. We started this July of 2015, and we didn't go live with it until April of 2016. So lots and lots of meetings. Over time, realizing we needed to add people to our team. We have pharmacists, case managers, nurses, medical assistants, doctors, nurse practitioners, primary physicians. The list is endless.
So we're designing a multidisciplinary team in the clinic and trying to change those workflows and patterns where we can help the patient have that care team around them. The core principle is patient-centered care, is best practices, best quality, most efficient with lowering the cost of care so that you get better outcomes at a lower cost, which I think that's really the point in healthcare now is deliver a better product, make patients feel better, but do it at a lower cost in a smarter way.
One of our biggest things that we were hoping to accomplish is to decrease our admission rate, which is something we've been successful doing. Before we started, the readmission rate for heart failure patients at Bellin was around 19 to 20%, and we now have that down to around 5 to 6%.
Patients seem to be very happy with it. I think they sense that there's a team of people around them, and when they say, I have a question about my medication, in walks a pharmacist. I'm having trouble with transportation, a case manager is there to help them. I'm having questions about end of life and decision making, and we have palliative care. So I think patients are satisfied that they feel like the care is more integrated, that there's more of a communication and coordination of care. I'd like to thank the congestive heart failure coordinators for all their hard work. This entire structure of this process was built on them and around them, and I can't thank them enough for the hard work they've done in this process.
I'd like to thank Andrea Werner for the nomination. That was exciting, and I feel very honored that she did that for us. I just want to thank the whole team. It's been great to see it finally come to fruition, and we're getting the program up off the ground, and we're making progress.